what I'm going to describe how AI is used in the system for decision support. Um, I'll show you what we have developed so far, but this is sort of an evolving area. As we go ahead, this would be more refined and more improved, and more sophisticated features will be added. So now I'm going to one of the patients. This is a patient list. You know how to go there. So through this all button, so you can get all your patients, or else you can search from there. So I'm going to one of these patients here. Um, and then you can see the profile. So more details of the patient profile is available in patient profile navigation video. Please refer that. But what I'm going to describe today is decision support module we have. Go to that tab. This is a newly added tab. Probably you won't see this in the previous videos. Now, this one generates, once you click that, so this from the profile, it creates sort of a prompt with the details. But we can improve this, like putting more information there, like clicking this, so that would auto generate from the information that we have. Now I have added the observation, current recent observation, and investigation, and how it shows how the investigation is changed with the time, which is important for the decision. So then now what I'm asking, the summarize the health issue. That's the question for the AI to think. Um, from here, of course, you can change the prompt in text as you need. But I'll probably I can this short-term and long-term care plan as per latest medical guidelines, something like that. So then what I would do, I would generate the text now through that button. So then that will show. Now this is what it shows. Now here the short one, it shows like very comprehensive, like that. So if I want to, let's say, if I'm happy with this, if I want to save this, so we can say save to patient notes, because then we can view this later on. This is one of the text that we have saved. Now I'm going to save this. Note saved. This support text is added into the patient general notes. So now the note is added. This is the one that we just added. What I'm going to do, I'm going to view this now. Here we go. Actually, it will be going into patient notes here. If you need more information, refer general profile patient note, general notes. All right, so that's one way. The other one we have here, we can just use this to have external LLM and get the output with more comprehensive details and structured way. So what I'm doing here, I'm copying this clipboard like this, then paste into something like, here we have Gemini, or else you can use other language model, LLM, like Copilot or ChatGPT. But we are planning to use ChatGPT LLM internally in the near future. So, there you go. I just, because the Gemini wanted more information, so which once I given that one, so it gives the short-term plan, diabetes, like this, education, blood pressure, control, anemia. So these are the problems actually came out from patient side, and then cardiovascular. I'm not going to read these because this is very comprehensive. So you can do this yourself and see how it works. Referrals. So it's very useful. So this would save a lot of time that you are navigating information, because prompt is the key. Now, in the future, of course, what we are going to do, we're gonna generate sort of list out of this, like a do list, which would communicate with LLM and get their inputs. Then that would be added like a do list, not like a text. Then system will track you throughout the process of care, whether these tick boxes are clicked on time. That's something will be available very soon. Now, the other question here, the privacy. Now, the prompt, it doesn't have any identifiable information of the patient. So, although you copy and paste into a external LLM, uh, no sensitive information will be going into other external providers. So that's really important, because we guarantee the safety and security of the privacy issues are addressed in this kind of approach. Um, the other one I wanted to show how in outpatient setup how this is happening. So I'm going to one of the outpatients here. Let's go to this particular episode. Now you can see the patient has come for a pigment lesion and lentigo malignant. The private diagnosis. So this information. Let's say this patient came for a clinic visit, and you want to generate some sort of guidance or decision support from AI. So we have here summary and decision support. So once you go there, so you have the prompt. It's already developed. So your prompt can be modified according to these inputs, as I showed in the other one, and you can put advanced or or short, whatever, and then let's generate. All right, so now based on the information, clinical analysis, blood pressure, lentigo, problems. Now this is learning because I sent several messages now. Now it's giving more structured way for this. Right, so let's put it this into Gemini and ask the same question. So we should be more comprehensive. In fact, you know, multiple. Now this is a summary. Indigo maligna, hypertension. The patient has a history of hypertension, recent blood reading. So it reads the blood pressure from the notes here. Here we go. So reads accurately. And then current medication to blood pressure suggests may not be optimally controlled. So look, and then probably you're not missing anything. And then poorly controlled diabetes, HbA1c 8.5, like it's indicator for diabetes. Then less than 7, it's a target. The trend of increasing HbA1c over the past years. So look, this is how it has picked. Indicates worsening of glycemic control. This increases risk of microvascular and macrovascular complications. So let's see whether it's accurate. HbA1c, here we go. Here we go. So with the time it has given, according to the time how it trends, then that analysis is there, and anemia again the same. I'm not going into details. So this is how AI can be used very effectively in healthcare, and the system actually helps a lot. So now this is like a guidance for us. So then once this is information is collated and given to LLM, and then it does the job for us. Then we can just continue with the plan that it gives, and we are not missing anything in this kind of approach. The other important thing, of course, as we go ahead, if we have, as I said, if we put it into sort of a live list, which has sort of tick boxes to complete the task, then we are not missing anything, and we are closing the loop of actions of this for this patient. Ultimately, the patient care will be enhanced. At the same time, your time and your energy will be saved, and then or you won't be overburdened of seeing a lot of patients in your clinics. Thank you very much for watching this one. Thanks.